This is a case of stent retriever used to reopen an occluded internal carotid artery. The patient is a 56-year-old male who presented to the emergency room with acute right hemiparesis and aphasia. NIH stroke score was 10 because of right-sided weakness, hemianopsia. His prior history of hypertension, hyperlipidemia. The stroke onset was unknown and therefore the patient was ineligible for TPA. CT perfusion, as noted here, shows large area of the left MCA which is at risk with increased time to peak, and based on volume there is a slight reduction in the volume in the top middle panel suggestive of possible completed core infarct. In the bottom left, the CTA shows what appears to be occlusion of a major proximal M2 trunk. This is establishment of a 9 French groin access, a VTEC catheter to access the left common carotid, and O35 wire being advanced over the VTEC, and in a telescoping fashion, a 9 French balloon guide being advanced into the common carotid artery. An angiogram at this point reveals what appears to be a total ICA terminus occlusion. So, with the balloon guide in place, a microcatheter and an aspiration catheter being advanced telescopically over an 014 wire. The wire, you can see, is being secured in place while the aspiration catheter is delivered. The microcatheter and the 014 wire are being advanced collectively, and a microinjection is performed to establish distal flow. At this point, a stent retriever is now going to be advanced through the microcatheter as noted here. The stent retriever is carefully pushed out and once in place unsheathed, and with the stent retriever in place, the aspiration catheter is being advanced around the tortuous clinoidal segment. The stent retriever is deployed. This is the Trevo stent retriever. Collectively, this is left in place. The microcatheter is removed entirely from the system. The aspiration catheter is then advanced over the stent retriever, and you can see the aspiration catheter juxtaposes the stent retriever. You can see the aspiration catheter and the stent retriever interact to potentially trap the clot. The aspiration system is on. The balloon is inflated in the cervical segment, and once the balloon is in the right place and with systems on, you can see the balloon is being inflated on the left-hand side of the screen. This is being secured. Aspiration is being applied both through the balloon guide with a syringe and automatically through the pump, and they are being collectively pulled together out of the body. And at this point, an angiogram reveals what appears to be excellent revascularization. We now perform formal AP and lateral runs to see if there are distal emboli that are noted, areas of vascular distribution which are missing. This appears to be a TICI-3 revascularization. This video demonstrates the Solumbra technique using an aspiration catheter, balloon guide, and stent retriever, all collectively to achieve optimal revascularization.